Hello, and welcome to the pharmacology portion of your Health and Wellness course, either Health and Wellness 3 or Health and Wellness 4. My name is Karen Klee, and I am the DSW coordinator as well as one of your health professors. I'm going to introduce you to what's going to happen in the next 3 to 4 weeks of your course. The ability to administer medication safely and effectively is one of the biggest learning outcomes for our DSWs in our health program. Our employers want our DSWs to be safe, effective, and knowledgeable care providers. They also want them to be able to reduce the risk of medication errors by recognizing things like dosage, techniques, documentation. So what's going to happen is going to be a little bit different depending on whether it's your Health 3 or your Health 4 course. In Health 3, you're going to spend the next 3 to 4 weeks in the lab practicing how to give medications, and then you'll do a medication administration and transcription test where you're going to research the drugs that you are actually going to give during your medication test. It's fairly straightforward, 3 drugs to give. In Health and Wellness 4, it gets a little bit more complex. We expect our students at that level to do a little bit more problem solving related to stop medications, discontinued medications, and PRN medications. So you need to be prepared that the expectations are going to be different in level 3 versus level 4. So I'd like to give you some hints about how to prepare for your drug administration test. First, you need to watch this video. Most importantly, the last section of this video that's going to go through a demonstration of what we expect during the test. I recognize that every agency is going to have different tools that they use, different protocols and procedures for medication administration, but what we strive to teach at Fanshawe is the guiding principles of the 7 R's to reduce medication errors. The next thing that you need to do is complete 3 peer evaluations before coming to your test. Those are a practice drug pour with 3 different students in your lab. You can certainly do more than 3 practices, but 3 is the bare minimum before you come to the test. As well, students often ask me what constitutes a fail in the drug administration test, because it's a pass or a fail. And you have to pass the medication administration to pass this course. So things that constitute a failure, first and foremost, are medication error. Any med error that involved either missing an incorrect dose, incorrect time, incorrect drug, incorrect person, though it's hard to do that in the lab setting, constitutes a med error and is an automatic failure. The other thing is that students don't consistently check all 7 R's 3 times, and that's our expectation, is that we're looking that you've checked each medication 3 times for those 7 R's, and I will demonstrate that. The next thing is there are 28 steps. Students certainly find those steps daunting. You do not have to do them in exactly the right order. However, they have to make sense. So you can get a few of the steps out of order, but if you have so many steps out of order that it's disorganized, that could constitute a failure. The final thing is if you go way over the time limit. We expect to be around 15 minutes in level 3 for 3 months and 10 minutes or less by the time you get to level 4. So those are the things that constitute a failing grade. So the next question is, what happens if I fail my first attempt? Relax. It's okay. You're going to get a second attempt. You're going to do your drug pours under video. I'm going to upload your video to a private YouTube site. You're going to get a chance to look at your video, see what you did right, see what you did wrong, complete a self-evaluation, and then you're going to come back at a time that's designated by myself or your professor and do a second attempt. Same drugs, same scenario. Now, if you fail that second attempt, then you've failed the course. But we're going to give you lots of time to practice in between. You also get a practice drug pour kit that you can take home and practice in between lab sessions. This is the technique that we'd like you to follow during your med testing. I need to make note of the date. It's June 6th, it's 1600 hours. I'm going to come onto my shift. The first thing that I need to do is check for narcotics, and if there are narcotics, count them. I happen to know that there are no narcotics today, so I don't have to count them. The next thing I need to do is quickly look at the medication administration record, or MAR sheet, for the meds that are going to be given today. So on June 6th, it looks like I'm going to be giving Tegretol at 1600 hours. I'm going to be given erythromycin at 1600 hours. If John needs Gravol for nausea associated with his antibiotic use, I can give that. And if he needs acetaminophen because of a fever, I may be able to give that. Although I noticed here right away that he last had his Tylenol at 1400 hours, and he can only have it every 4 hours. So hopefully he doesn't have a fever, because it's too soon for me to give him that medication. So the next thing I'm going to do, and you don't normally have to do this step every time you give medications when you're out in the field, but we want you to demonstrate it here, because you will always have to do it the first time you get new medications, is to confirm your doctor's orders with your MAR sheet. So that's what we're going to do first. So we have John Wayne. His birthday is June 22nd, 2006. It's June 2018. He's at Fanshawe. He's allergic to NSAIDs. He doesn't have any NSAIDs, no aspirin or ibuprofen. His medical conditions are epilepsy, Down syndrome, and pneumonia. All right, so his first doctor's orders is discontinue Tegretol 500 milligrams BID. I see that that's been discontinued, so I don't have to worry about that. Start Tegretol 250 milligrams by mouth PO/QID to provide better seizure control. So they're spreading out his Tegretol a little. So Tegretol 250 by mouth, 1 tablet 4 times a day, and the times here are 8, 12, 16, and 2000 hours. The next thing is erythromycin. It's on page 2 of our MAR sheets. So erythromycin 500 milligrams by mouth every 8 hours for 10 days. Now, it's available in 1,000 milligram tablets, so the pharmacy is telling me give half a tablet, which makes sense because I'm only giving 500 milligrams. So give half a tab by mouth every 8 hours for 10 days. Oh, and the pharmacy instructed to give it with food or milk. Okay. The next order on here is acetaminophen. It's down here. So acetaminophen, 650 milligrams. 650 milligrams by mouth every 4 hours for a fever greater than 38.5 degrees Celsius. And it's in a liquid version, concentration 160 milligrams over 5 mLs. So the pharmacy tells me to shake and give 20 mLs by mouth every 4 hours as required for his fever. And I see that he already had Tylenol or acetaminophen at 2 o'clock. Since it's 4 o'clock, 1600 hours, I can't get that Tylenol yet. The other drug is Gravol, 50 milligrams by mouth every 6 hours as needed for nausea associated with his antibiotics. That's why they're asking me to give it with food. So, and it's for 10 days, along with the antibiotics. So, as per pharmacy, give liquid concentration, 100 milligrams per 5 mLs, got that. Shake and give 2.5 mLs by mouth every 6 hours as required for nausea. He had it at 8 o'clock this morning. It's been 8 hours, so if he's nauseated, I can give that to him. So let's go check out John and see how he's feeling. Okay, when you come over to meet the person that you're going to give medications to, we expect that you're going to read the case scenario that we're going to provide to you. So before I introduce myself to John, I'm just going to read the case scenario. So John is 12 years old and has epilepsy. Recently, his seizures have not been well controlled. 2 days ago, he experienced a prolonged seizure, aspirated on his saliva, and now he has aspiration pneumonia. He started treatment yesterday after he had trouble breathing and had a fever. This afternoon, he is feeling nauseous from his antibiotic, but his temperature is normal at 37.0 degrees Celsius, which is good because he's already had Tylenol or acetaminophen. He is awake and munching on some crackers, to try to feel a little bit better. Okay, so I know he's got some nausea. I'm going to check in on him now. Good afternoon, John. How you doing? Right, so coughing a little bit. You had a fever earlier today, but you don't have one now. How's your tummy feeling? A little nauseated still. I think I might be able to get you something for that. And dinner's on its way as well, but I'll bring you a little snack as well, just to help with your tummy. You keep munching on those crackers though. So I'm gonna go get your medications ready, and I'm gonna be back in about 10 minutes, okay? Sit tight, talk to you soon. Okay, med cups, one for some water, one for the milk. I'm gonna need a tissue, and 3 med cups. All right, I don't want this stuff in my way, so I'm gonna actually put it down and get it out of my way. All right, so now I'm gonna start getting everything ready. I'm gonna always start with the first drug on the list. So in this case, it's Tegretol. So here's my Tegretol. So I'm gonna begin this first check for the 7 R's. John Wayne, Tegretol, 250 milligrams, 4 times a day, give 1 tab, that's our dose by mouth. I'm gonna give it at 1600 hours. It is 1600 hours now. I have all the documentation in place. There's no extra technique. And so that's the 7 R's. I'm good to go. So now, because it's in a blister pack, I'm just going to check to make sure that it hasn't been tampered with, and do my second check for the 7 R's. John Wayne, Tegretol, 250 milligrams, 4 times a day, 1 tab by mouth, 4 times a day by mouth. The time is 1600. No one else has given this medication yet. So now I can pop it out of my blister pack, check to make sure it all came out, 1 tab in there, do a final check for this medication for the 7 R's. John Wayne, Tegretol, 250 milligrams, 4 times a day by mouth, 1 tablet. I've got 1 tablet, and I'm giving it at 1600 hours. It has not yet been given, and all my documentation is in place. I forgot a pen, so I'm going to reach down here and grab out my pen. So I'm going to put a little dot in the time frame in which I'm going to be giving this medication to know that I've poured it, put it on my tray, put that medication away so it's out of the way. Next medication, on to page 2, is erythromycin. All right. John Wayne, erythromycin, 500 milligrams by mouth every 8 hours, and it's 1600 hours, no one's given it yet. Give half a tab of 1000 milligrams, so it's only available in 1000, so I gotta give half a tab to get that 500 milligrams. Give it with food or milk. Let's put some milk on that tray right now. For 10 days. Okay, all my documentation is in place. The technique is the milk. All right, I'm going to take the cap off, turn it upside right, do my second check. John Wayne, erythromycin, 500 milligrams by mouth. Give half a tab of 1000 milligrams. That's going to get me to that 500 milligrams. Give it with food or milk every 8 hours, 1600, no one's given it yet. So now I can pour it out. Now I can see that there's some whole tabs and some half tabs in here. I want this half tab. It's going to be tricky. So I'm just going to pop that. We should probably not have to touch it. Half a tab. The other one's back. All right, I've got half a tab. Time to do my third check. John Wayne, erythromycin, 500 milligrams by mouth. Give half a tab of 1000 milligrams, I've got half a tab in here. Every 8 hours with food or milk. Here's my milk, and it's 1600 hours. It hasn't been given. in the last 8 hours. No one is signed for it, and all my documentation is in place. So, put a little dot there because I poured it, get it out of the way, put it on my tray. Last medication. I can't give the acetaminophen, it hasn't been enough time, and besides that, he doesn't have a fever. However, he does have nausea, so I'm going to give him some Gravol. Alright, so John Wayne, Gravol, 50 milligrams, and it's a concentration of 100 milligrams per 5 mLs. Perfect. Give every 6 hours as required, for nausea with antibiotic use. He does have nausea, I checked in on that, and it's been more than 6 hours since the last dose. The last dose was at 8 o'clock in the morning. So I'm going to shake and give 2.5 mLs. Shake and give 2.5 mLs. Good. So that's my special technique, is to shake. So we should always make sure the cap's on. So let's give it a shake. All right, let's take the cap off. Put it right side up. Do my second check. John Wayne, Gravol, 50 milligrams every 6 hours as required for nausea. Every 6 hours as required for nausea. He is nauseated. It's been more than 6 hours, 1,600 hours. This last dose was at 8, and it is 1,600 hours. So, shake and give 2.5 mLs. I've shaken it and given that 2.5 mLs. Good. Now I have to pour it. So I'm going to put my hand over the label and start pouring. Now 2.5 mLs is a very small amount. It's right at the bottom. So the best thing to do is to get down to eye level if you don't have a syringe. Ooh, don't be too heavy-handed in there. 2.5 mLs. 2.5 mLs. Nice. All right, so I'm going to wipe off the top so it doesn't get too sticky. Put that cap back on and do my third and final check. John Wayne, Gravol, 50 milligrams every 6 hours as required for nausea. He is nauseated. It's been more than 6 hours since his last dose. Shake, I shook and gave 2.5 mLs. There's 2.5 mLs in there. All my documentation is in place, and that is good to go. So, I put a little dot in the time here. I'm not going to put my initials yet. All right, I've got my milk and my water. So, let's go over and give these medications to John. Okay. Good afternoon. Could you just remind me of your name again? John? What's your last name? John Wayne? Excellent. Thanks. Okay, I've got your medications here, John. So I'm going to give them to you. I want to make sure that you're sitting up nice and high, which you are, so that's great. You're okay to swallow. Good. Still feeling a little nauseated? That's okay. I've got something for you here. So the first thing I'm going to give you is your Tegretol. This is for your seizures, okay? It's going to help a little bit. Take that. Here's a little bit of water. Excellent. Can I see that you swallowed? Perfect. Okay. The next drug that I'm going to give you is erythromycin. So it's half a tab. Got some milk here to go with that. So here you go. This is for your pneumonia. Sorry, I should have explained that to you. Here you go. And some milk. Wonderful. Swallowed. Perfect. Last thing is that Gravol. That's going to help you with your tummy, okay? To make you feel a little less nauseated. There you go. Follow that up with a little bit of water. Excellent. All gone? Perfect. I want you to stay sitting up for a little while, and I'm going to come back in about 30 minutes and check on you. Okay? Talk to you soon. I'm back from giving John his medication, so the first thing I'm going to do is wash my hands again, and then sign off on everything to finalize all of my documentation. During the testing process, you are not going to throw away your medications because either myself or the other professor has to come out and check your dosage. So normally you would be discarding all of your med cups and your any other waste, but for the purposes of testing, you're going to leave everything right there. So final thing that I need to do is sign off on everything. Okay, so Tegretol I gave, sign my initials, sign sign this MAR sheet. Erythromycin at 1600, I gave that. Sign this MAR sheet. Gravel, I gave it at 1600, put my initials, sign the MAR sheet, which I already did, and acetaminophen I didn't give. So that concludes my medication administration aspect. Now all I have to do is go back and check on John in 30 minutes and make sure he's doing okay. Okay, so it's been 30 minutes since I gave John his medication, so I need to come back and check on him. Hi John, how you doing? Oh, your tummy's a little bit better. Oh, that's great. I'm glad to hear that. You're feeling hungry? I'm going to get you some dinner. That's great. How's the cough? That's still there, isn't it? That's okay. It's going to take a few days for that to get better. So I'm going to go get your dinner, and we'll see you soon. That ends the demonstration aspect of the medication administration test. We'd like to encourage you to follow the same steps as you've just seen in this video, where you're going to go through things step by step, talking outside so we can evaluate you thoroughly and effectively. Remember that we're looking for those 7 R's checked 3 times. Just as a reminder, those 7 R's is that you've given the right drug to the right person by the right route at the right dose at the right time using the right technique and the correct or right documentation. As long as you do those 7 R's 3 times and don't make a medication error, you're going to be just fine.